We like to think that UMass Fitchburg Family Medicine Residency has the best of all worlds for you as you choose where to continue your training.
Our residency is one of over 50 residencies and fellowships at the UMass Memorial Academic Medical Center. But the bulk of our inpatient training is actually located at Health Alliance, the medical center-owned community hospital in Leominster.
We are the only training program at Health Alliance, which provides our residents direct access to a wide array of specialist physicians who love to teach, and a more friendly, supportive environment in which to learn that is often seen at large academic medical centers.
I really enjoy the fact that most of our inpatient training is at a community hospital. We're the only residents there, so we have direct access to all of our attendings. We don't compete for procedures, deliveries, anything that's going on, we're always welcome to be a part of.
We weren't sort of competing with internal medicine residents or fellows or any other programs, and so there was a lot of attention towards us and how we were treating our patients.
I did a second look in the hospital, so I had a chance to sort of do some rounding in the morning, and it just felt very comfortable to me. I felt like speaking with the attendings, I felt comfortable asking questions, and I didn't feel intimidated or overwhelmed, so I felt like that fostered a good learning environment.
Our family health center, Health Alliance Fitchburg Family Practice, is housed in a new, state-of-the-art ambulatory health center, specifically designed with residency training in mind.
We believe strongly in team-based care. Our core faculty have a wide array of interests, including osteopathic medicine, sports medicine, obstetrics, obesity medicine, and point-of-care ultrasound.
We augment this with psychologists and a psychiatrist for integrated behavioral health care, and academic pharmacists, all available to assist you in caring for your patients. Our patients come from diverse backgrounds and are mostly medically underserved. Medication-assisted therapy for opiate use disorder using buprenorphine has been fully integrated into our care for over 10 years.
Another, I think, great strength of this program that drew me to it was the OMT curriculum. We have designated rooms with tables such as a McManus table set up designated for OMT. Having Dr. Leonard here, who is an exceptional OMT educator, is another really great strength of the program and one thing that drew me to it.
We have a longitudinal osteopathic curriculum that not only DOs but our MD colleagues take part in as well. And I really like that the learning environment is for everybody. In addition, I have OMT sessions throughout the day, so it kind of keeps my skills fresh, and we have dedicated attendings that come in and kind of help us grow our skills too.
Residents have ample elective time, which they can take in traditional block format or longitudinally. Resident wellness is given a high priority. Every week, there is time assigned for wellness activities that residents plan themselves. These activities have included a wide array of lectures or experiential activities, such as yoga, hiking the local trails, or even just meeting at a coffee shop, pre-COVID, of course. The residents also have 2 retreats each year to learn in a more relaxed setting and to become a more cohesive team.
I think there's a lot of maybe informal and informal resources for resident wellness incorporated into our program that is another strength of it. Not only do we have designated wellness days and opportunity in the clinic to explore mindfulness techniques and wellness techniques, but also the informal setting of having a close-knit group of residents outside of the clinic, meeting up for some ice cream, going on a hike.
Our program makes sure that residents have a good work-life balance and that our work hours are usually not maximized. I think we try to fit in all of the learning that needs to happen in every rotation, but we're not trying to fill that time necessarily, but just make sure that the time that you're here in clinic or you're in the hospital on a rotation is well spent and well directed.
We are involved in the community, participating in sports physicals, wellness fairs, nutritional programs, and public education. The greatest strength to our program is the hardest to quantify. We are a kinder, gentler, friendlier program who truly emphasizes teamwork and support.
That doesn't mean that our training program isn't rigorous. You certainly will graduate from the program ready for practice. It is just that we do this academically rigorous program with teamwork and support, rather than competition and isolating individuals.
We really are a close-knit group, and I think it really speaks a lot to be able to have your faculty and even specialist cell phone numbers in your phone. It makes it very easy to learn.
I was able to get that more intimate experience in doing what I want to do long term, which is working in community health in an underserved population, but at the same time be connected to a larger university and have the academic and research opportunities.
It's a great learning environment, both from the faculty, the co-residents. I'm so happy that I made this decision to be here, to have the community hospital, to have, being the only residents in that hospital, but then also having the advantage of the larger center.
I feel that it provides me enough autonomy in the clinic and in the hospital to challenge myself, but never feel overwhelmed. I think I'm always growing as a clinician, and that's really exciting.
We want to bring out the best that we can in each resident. We're taking people from where they are and getting them to becoming a well-rounded, kind, capable, independent practitioner.
It's a family, and when I was ultimately matched, it felt like I was coming home. It's a combination of some of the best residents I've ever worked with some of the best faculty I've ever worked with, and the patient population themselves are really fantastic to work with.
Thank you so much for your interest in our residency program. I really look forward to meeting you when you come for your interview. But in the meantime, if you have any questions, don't hesitate to contact me or anyone on this video.